Good thing I hit that in there. And it will be posted on the Office of Rural Health website on Monday. Sarah Anderson is our tech support during the webinar. If you have technical questions, please enter them in the chat box and Sarah will provide you support. You are all currently muted. You're all currently muted and your video is off. Enter your questions in the chat box and I will be happy to read your questions, or raise your hand and I will take you off mute so you can ask questions. After the webinar, I will send out a survey. Please take a minute to complete the survey. And hopefully Janice is on and we are ready to start. Okay, well, I have several questions for you, Janice. And okay, if you're ready, let's get started.
I am ready.
Okay. How is a survey during COVID-19 pandemic different from a survey pre-pandemic? Can you explain the difference?
Some surveys remain the same. If we enter a facility for a recertification currently, when that's allowed, then the COVID-19 focused infection control survey is automatically put into place. So anytime we enter a facility, for whatever reason right now, we add on the focused infection control surveys. Right now, with the counties that are at extreme risk, we are again limited onto where we're going. We go in for an IJ situation, or we'll go in if there is a complaint regarding infection control. Until the risk is lowered, we are going to kind of stay away. Once we're at a low level, we'll go back to recertification surveys and initial surveys. Complaint surveys are put on the back burner unless it's an infection control survey. So,
okay,
go ahead.
Is there a possibility that you could do virtual surveys?
For recertifications, probably not. If we get direction from CMS that we really need to, catch up our backlog, then that's a possibility. When we do go in right now, if we're in for a complaint survey, we are in and out. So I will go in and enter in person, do some observations, what's required, and then most of the document review and any interviews that are done are all done remotely. So I'm on site as little as possible when I am on site.
Okay. How should a clinic be prepared for a COVID-19 survey?
So there's the focused infection control, COVID-19 focused infection control survey for acute care facilities that hopefully everyone has seen or is aware of. Really go through the survey, be prepared for all the items that if we're on site that we would take a look at. Stay apprised, up to date of all the COVID-19 regulation changes, updates, any waivers that are in place. And again, that you can find those at the CMS, the CDC has them, and also state and local guidelines are in effect. So it's kind of, the information's out there to be found. Sometimes it just takes a little while to find the exact information. But the focused infection control survey worksheet is really a great resource.
Okay. Let me see if I have. I think I answered Dan's. Or Janice answered Dan's. Okay, here we go. What survey activities will be performed off-site?
Most of them. So part of the infection control survey, there are observations. So I watch how staff, don and doff their PPE. I watch if mask protocols are being followed, interactions with the providers, office staff, I will observe. And then I'm out of the facility as soon as the observations are in place. Document review, we arrange to send it through emailed or shared drives. Interviews are part of the focused infection control survey. So I do a lot of the interviews remotely. If I have a chance and I see that a staff member isn't involved in patient direct care, then I can try to interview on site. But as much as we can do off site, we are doing.
Okay.
The exit conferences are always done off site. So there's just a lot of back and forth with usually the facility administrator, where I'll review documentation, I'll come up with a list of questions and then email, and we arrange either a time to talk or just do the question and answers through email. So it slows the surveys down quite a bit.
Thank you. Does Janis look at the OSHA temporary rules for COVID?
We got a list of them yesterday, so I have looked at them, and I try to be careful as to what is our regulation and what is OSHA, but we are aware of them.
Okay.
But OSHA is not our jurisdiction.
So I had questions about some more detailed questions about the on-site survey activity that is performed. So are you observing hand hygiene practices by staff? Will you be doing that?
Yes.
Okay.
Always.
And proper use, discarding of PPE?
Right. Are they donning their PPE correctly? Are they taking it off correctly? Are they disposing of it correctly? Are they using the proper PPE for the type of patient that they're seeing?
Okay. And then hand hygiene practices, I guess I should go back to that. Can you tell me what you're looking for there?
Well, that I would hope would be in place pre-COVID or post-COVID, that the hand sanitizers are used in between patients. You're washing your hands with soap and water, that you make sure if you are in contact with the patient, maybe, you wash your hands or use the hand sanitizer. The hand sanitizer is readily available. And then any instruments that come into contact with patients. So if you're using a stethoscope, is the stethoscope wiped down in between patients? As patients enter the facilities, often their temperatures are taken with various types of devices. So if it's a thermometer, is the thermometer wiped down between each patient? What are they using to wipe it down with? Those type of things. So especially in between patient care, is everything being wiped down and with the correct type of disinfectant?
Okay. So standard and transmission-based precautions. So signage. Are you looking at signage, and what would be your expectation there as you're entering the facility?
Yes, so we do look at signage. I would be looking at signs about wearing masks, proper way to wear masks. Typically we are seeing that no visitors are allowed. So it is just the patient. Sometimes with the clinics, we'll see signage that you need to phone in to let them know that you're here. That depends. That's very facility specific if I need how they register when they're on site. But I do look for signage as I enter into the facilities. Okay.
And okay, so we talked about you look at the equipment. Would you watch how it is clean and disinfected?
Yes.
And
what that it is done, and then what it's, what they use to clean it with and how it's cleaned. And yes.
so will you be asking for detail on the drying time?
It's one of the questions that could come up if needed.
Okay.
Sometimes I can just observe that they're doing things correctly, and then there are no follow-up questions. So part of the on-site observation may just include, talking to staff, that's in the middle, well, not in the middle, because I don't get in the way of direct patient care, but that they understand what they're doing, do they know why they're doing it, and just sort of questioning them on their education for the COVID-19 precautions.
Okay. So you will be interviewing staff then, and you will be asking them questions on processes and protocols.
Yes. So questions, random questions, if I see something that maybe someone's not doing correctly, I would just ask them to explain the process. I try hard not to put them on the spot, but just having them explain the process. I might ask about what type of education they've received for especially there are so many changes that are coming down constantly from CMS, how aware they are of that, how are they getting educated, and monitoring how are they monitored daily as they come in for their own signs and symptoms of the virus.
Okay. Let's see. So when you're interviewing staff, would you ask them questions like how they notify local, state public health officials regarding identification of COVID-19 patients?
I would ask the staff if a patient presented with signs and symptoms, then what is their process from that point on? So, how a tech answers the question is different maybe from how an RN or a mid-level practitioner would answer the question. So that I would just check that each staff member understands the process from their job description point of view.
Okay. So would you be asking a question such as, does the clinic know how many patients have been diagnosed with COVID-19?
Yes.
Okay. Do they need to establish a surveillance plan?
Yes, they do. So especially for staff, they need to make sure that there's a surveillance plan in place for staff and how they monitor, how they're going to do it daily, how they're going to, keep track of who's monitored, how they're monitored. Because I always will check those records. If I have to come into a facility, I will ask for those records. And then I'll ask the policies and procedures to make sure that they are following their own surveillance process. Patients, hopefully that's part of just their patient questions, signs of symptoms before or as they're checking in. And then if a patient is presenting with COVID-19 symptoms, what is their process? How do they separate them from other patients, if there are other patients in the facility, just what their process is.
Okay.
Again, every facility has their own process in place, so that's why some of these answers are very general, because no two places are the same.
Right. So let's see, education, monitoring, and screening. So you will expect staff to have education.
Yes, and I will look at education records.
Okay. So education, monitoring, and screening. You'll
Yes.
have expectation of those three things.
Yes.
So how the staff has been educated on COVID-19. Are staff screened each day? Would that be an expectation for fever, signs, and symptoms?
Yes.
Okay. And then a process if staff develop symptoms at work?
That they would have there is a process for if staff do develop symptoms at work. There's a really good link for the OHA and how that would be handled. I can send that out, and if anyone's interested in it, but that they are following those guidelines for how they, if they present at work.
Okay. Okay, that would be great.
Yeah.
If you send that to me, Janice, I'll send it out.
Okay. Well, the document is called Clinical Care and Healthcare Infection Prevention Control Guidance for COVID-19, and these are for the healthcare providers and not just the general population.
Okay, you did send that to me, and I did send that out to
great.
the registered attendees.
Great.
Let's see. How long will you be performing this added COVID-19 focused infection control survey? Is it indefinitely, or is it just during the pandemic, or?
It is. We are doing these focused infection control surveys under the guidance of CMS. So until CMS tells us differently, then we will conduct them when we are on site. So even if, say, the county that facility in goes to a low risk category and a surveyor comes in to just do a recertification, and then we would still add on the focused infection control survey until CMS tells us that it is not part of the surveys. Same thing for a complaint. If we get a complaint and we are on site, then we add on the infection control survey. So as far as we know, we do not know how long they're going to last.
Okay. And this added survey is just a part of the regular initial certification or recertification.
The survey does not have its own regulation code set the way there are the guidelines for rural health clinics, where there are the state operation manuals for the dialysis centers and every other type of provider. This one is just added on. So for rural health clinics, for whatever infection control they practice, if we have to do any citations, any deficiencies, that would just go under their guidelines, their deficiencies for their infection control. So it's not a separate set of regulations, it's just incorporated into the guidelines. For the rural health clinics or hospitals have their own, ASCs, ambulatory surgical centers have their own rules. So it just is incorporated under the infection control.
Okay. Dan is asking, I thought I heard Janice say there should not be any visitors. If our visitor policy allows a visitor, is that okay?
Some patients have to have a visitor with them. So that's how you write your policy. For whatever reasons patients would need a caregiver to accompany them, then that would be included in your policy. Sometimes that can't be avoided, but if at all possible, then patients should be requested just to come in by themselves. They have to be driven there, even if the drivers can remain in the cars, if the patient's able to ambulate and get to inside the clinic by themselves, that would be the best case scenario. But sometimes visitors are required for patient safety.
So as long as it's in the policy and they're following the policy.
Yes.
Okay. Okay. So when entering the facility, what will you look for?
What I would look for any type of survey. You know, I look at the infection control precautions that are in place. Is the facility clean? Do you have items that could easily spread, like, you know, the toys or books in a waiting area? Are those there? I'm watching, you know, hand hygiene. Are they gloving appropriately? Are they disposing of their PPE appropriately? If it's just an infection control, I tend not to go through and look at all the medications for outdates or, you know, things like that. I don't go through the supply areas as much as I would on a regular survey. So it's just, I would observe, you know, direct patient care, if with the permission of the patient, of course, you know, at the point from when the patient is called back to the care area. So just and observe staff and how staff are doing their hand washing, how staff are, you know, are the instruments being cleaned, just that type of observations.
Okay. So to drill down a little bit further, so
Okay.
what would you expect when you walked into the waiting area?
I would expect to see, well, again, I'd be coming in, I'd be looking for signage as I enter the facility.
Okay.
I would, especially signage for how the patient is to present, or they do sometimes just see the signage in the parking area by the front door, wait in your car and call in, or, you know, make sure you wear a mask. I'd be checking to make sure that they have social distancing set up so that patients, if they are in a waiting room, that they are at least 6 feet apart and separated. And again, just for cleanliness, is hand sanitizer available? That kind of thing.
Okay, so no pamphlets, no magazines, no books, no toys.
Well, no toys unless the toys are clean between each person using them. Pamphlets, I think I would tend to probably not focus on as much. Magazines, I would, in the waiting area, again, anything that can't be clean between each person, then I would probably lean towards hiding that as an infection control issue.
Would you expect the chairs to be spaced 6 feet apart, or what would be your expectation there?
I mean, I've seen it different ways. The chairs are 6 feet apart, or they have chairs marked that do not use, so that they are not side by side and at least 6 feet apart. So sometimes the areas, you know, they're so small that it's hard to move furniture around. But just, you know, there's a sign there that says "Do not use this chair," and, you know, just so that the patients that are in there are at least, again, the required social distancing.
Okay. Apart. How about, would you allow a drinking fountain to be in use?
Probably not, but I could be wrong on that one. But okay. I would say no.
Okay. In most facilities, I have seen it where their drinking fountain isn't in use, but I didn't know that for sure, and so I wanted to check on that as well.
Yeah.
So what will you be looking for in a COVID-19 infection control policy?
That they have reviewed the guidelines that are in place through CMS and the CDC, that all is incorporated into the policy. So I'll be looking, and often it's numerous policies and not just one, that they have the policy for how they're going to educate the staff, when the staff will be educated, how they're going to educate it. So if their infection control policies change, if they, and especially, from March through now, there have been a lot of changes. So I'd just be looking at these are updated constantly and are current with the guidelines.
Okay, and so if someone uses a service like InquaSeq and their documentation is online, can you review that separately? Do you have a problem with that?
Nope, as long as they can find a way for me to review the documentation. So sometimes it's, they have to print it out. And again, most of the document review is done remotely. So it is a little bit more work for the facilities, and I do understand that. But they would print the evidence that education occurred and probably email it to me, and then I would review it that way. So I would ask for a list of classes that they've offered or types of education that they've had, and then documentation of which staff has actually, attended it and been part of it.
Okay. You might have covered this, but I want to ask you one more time. What are you looking for when you observe a staff using PPE?
Again, that they're using the appropriate PPE. Is a gown required? Is the gown not required? What type of gown? Is a mask required? What type of mask? Do they need do they need an N95? Do they need a respirator? Do they need the goggles? So different types of patients need different types of PPE. So are they using the appropriate PPE? And then when they are using it, are they putting it on correctly? Because there are steps on how you put on PPE. Once they're done and they're ready to discard the PPE, are they taking it off correctly? Are they disposing of it correctly? Are they using gloves correctly? Are they sanitizing their hands correctly? So again, it's dependent on what type of patient they're seeing and what PPE is required. And then I also make sure that they have adequate amounts of PPE, and just let them know that if they ever have trouble obtaining it, to let us know, and we can make sure we plug them into resources where they can obtain more.
Okay. Thank you. Let's see. What type of COVID-19 infection prevention questions are you likely to ask staff?
Well, I would, what type of education have you received? If a patient were to present to you with signs and symptoms, do you know what to do? Do you know how to use your PPE correctly? Do you know when to wipe down your equipment? So, tell me about the facility's monitoring and surveillance program for staff. How does that work? So those kinds of questions. Questions also like, do you feel like if you yourself were feeling like you had signs and symptoms, do you feel like that your employer is going to pressure you to come into work anyway? Do you feel like you can call in sick and do what you need to do safety-wise, or do you feel like you're going to be pressured to come in and work?
Thank you. What would you expect? Should the COVID-19 policy be separate from the infection control policy? One policy, does it matter?
again, if they're normal everyday infection control policies, incorporate all the COVID-19 policies, you know, things that may have changed, regulations, and that's fine. But typically I have seen a COVID-19 specific policies for COVID-19. So, you know, for some facility types, you know, typically they wouldn't wear masks for, you know, any patient interactions, and then under COVID-19, masking is always required. So would that be, you know, masks for every patient be part of their regular infection control policy pre-COVID-19? Probably not. So I would be looking to see how their policies include that.
Can you name other policies that you may review?
Well, again, you know, I'm looking at, if I'm there just for COVID-19 infection control survey, those are the only policies I'm going to take a look at. And I'm going to ask to see all of your policies. So, and then I would take those policies, review them, and then determine if there are any further questions. If I am there and doing observations and I see, you know, issues with hand hygiene that's not being followed, or, you know, they're donning and doffing the PPE is correct, or they're not wiping down their instrumentation, then that could be just in their normal infection control policies, and I would ask for those. If by chance, you know, if I see anything at all that I think needs further inquiry, then I would ask for that policy. So it may be just a normal facility policy that covers it. It may not necessarily be an infection control. So if I were to pick up a multi-dose vial of something and saw that it was dated wrong, you know, that does fall under infection control. So that would be probably not in their infection control policies, but just in their medication policies. Because when I'm there, I'm looking at all infection control. So if I felt like I needed to, you know, go through their medications to see if everything is, you know, within the dates that they have not expired, then I could do that. So anything that would ordinarily be covered under the infection control parts of the regulations, I could look at any of those.
Thank you. Okay, can the exam room have cloth pillowcases? I've been asked, some of these questions I'm asking you, I have been asked in the past.
You know, I still see cloth pillowcases. Again, I look at the facility's policy for cleaning of the pillowcases. And if the policy determines that they are, you know, cleaned and changed between each patient, then I think it's okay. If they're not, then that would be a citation. So again, the cloth pillowcases is determined by the policy they have in place for patient use.
What would you expect to see on the exam room calendar? What would be maybe a typical exam room countertop?
Well, gosh, some places I go and there's almost nothing on the counters. So, and some places I go, it's pretty cluttered. So that is not my determination for what they have out. When I go in, I would just look at what they have there can be cleaned or you know, fits with the infection control protocols.
Okay. So what is the expectation for RHCs to notify local health officials when they have a COVID-19 positive test?
They should notify their local public health agency. Often the lab will too, but again, the facilities need to know what patients are COVID positive. They need to track those and notify the local public health agencies. And then the local public health agencies will send in contact tracers if that's appropriate, and they can contact trace the staff as well as other people that COVID positive patient has been around.
Since the pandemic, what are the changes in cleaning, signposting, and policies? This was a question that was emailed to me.
There are changes in posting of signage. Again, if you look through the workbook that I think you've sent out to folks, that gives a good idea of what signage would be good to have up as a minimum. And other than that, the changes there are a lot of changes. It's just a matter of looking through the Oregon Health Authority's webpage to see what the current regulations say, looking through CDC. It's just really keeping up on the current COVID-19 precautions.
Thank you. What are the top 3 things surveyors focus on during survey? Now, I think this is just an overall question.
Well, infection control is always, one of our primary areas that we focus on when we're on site for a survey, for any type of survey. The only time we might have blinders on is if we have a complaint survey that's very specific to one thing. We typically only go in and look at that one thing. But any other type of survey, all the game. We look for just a normal survey. I looked at all the equipment. It has maintenance performed on it annually or as per the equipment's the maintenance record would the company requires they have. I look at personnel files when I'm there, and then I look at patient records while I'm there.
What is your advice for RHC managers who have not participated in a survey previously?
There are places you can contact. So Ron Deanna and the Office of Rural Health is an excellent resource. They can guide you through mock surveys. They can tell you, keep you current on what the regulations are. I cannot do a mock survey. I cannot give guidance on changes you can make. I have the unfortunate position of really just to tell you what you do wrong. I don't get to tell you what you do right, or I don't get to tell you how to fix things. So I am often referring clinics back to the Office of Rural Health that can give more information and more advice than I'm able to.
Okay, thank you. Can you name some common mistakes and deficiencies made by RHCs?
Just in general, or?
Yeah, in general, and if you have any regarding the COVID-19 infection inspection as well.
We haven't done a lot of the focused infection control surveys, so that's a good thing. But definitely one of the first things I look at is now when I approach a clinic is, looking, do you have your signage up? Is it appropriate? And so could you repeat the question, Rondie Ann?
The common mistakes and deficiencies made by RHCs that maybe you could let the RHCs know about so they could work on those.
Great. Yeah, again, some of the most common things I see is the emergency preparedness plan that either is not in place at all, they don't have one, or a lot of parts of it are missing the training and testing portions of the emergency preparedness. So even part of the infection control survey refers to that emergency preparedness, and that do you have a backup staffing plan? If all of your staff were to test positive, if you had a surge in your own clinic, what is your backup staffing plan? The program evaluation, I often see gaps in that one where they haven't had one in the last number of years, or that they're missing parts of the program evaluation, specifically, the review of policies and procedures that are to be done and with the correct people that are supposed to be doing that. So for policy and procedure review, you need to have your medical director, your clinic director, one of the practitioners, one of your mid-level practitioners, be it a nurse practitioner or the PA, and a member that is not part of the clinic staff. So there's at least the minimum of 3 members that should be reviewing the policies and procedures. Is the medical director and the mid-level practitioners, are they going through and doing their chart reviews and chart audits at the pace that is determined by their own policies and procedures? Do you have, and back to the policies, or those policies, there are some policies that are very specific to the rural health clinics, and some that you're part of an integrated network that you can use those policies as long as the clinic is recognized as part of that integrated health network. So just be aware of the policies and procedures and the reviews for those. And typically, physical environment is always a big part of the clinic surveys, where I am looking at your equipment. Do you have a preventive maintenance contract? Are your medications outdated? Do you know how to properly use the multi-dose vials? Is your clinic in need of repair? Are there big holes in the walls? Or do you have peeling wallpaper? Those are, infection control issues that I would cite. So that's what I'm coming up with at the top of my head.
Okay, thank you. So I want to go back a little bit and talk about not a member of the staff. So you have the medical director reviewing the policies, and you have a mid-level, an NP or a PA, and then you have somebody that's not on staff at the clinic.
Yes.
What types of people do you see participating in that review?
You could request one of your local fire officials be part of that review. You can request different type of nurse practitioner that's not affiliated with a clinic, or another medical doctor that's not affiliated with a clinic. It just, some of the communities are really small, and, they may have, a lawyer that's well known. So just a member of the community that's not part of the staff for the policy review.
Okay, I think we have about 8 minutes left. I'm wondering, I think I should open it up and see if there is anybody that would like to ask any questions. I'll be happy to unmute you if you raise your hand. Or you could type in the chat box. I just don't want to, I want to give the participants an opportunity to ask questions as well.
Sounds good.
And if there are no questions, I have a few more, but anyone? Okay, so I'm going to ask a couple of other questions and give anybody an opportunity to raise their hand if they have questions. Okay. So I want to ask a question about, so there's two different types of chart reviews. There's the chart review, and so I just want to make sure that I understand that. There's the chart review that's completed by the medical director, and then there's the chart review that can be completed by medical records or the person that's responsible for medical records. Can you tell me a little bit more about that?
So what I'm looking for is that typically you would see sometimes, I don't know, off the top of my head, 10% of say a nurse practitioner, 10% of their patients would be audited by, does not have to be the medical director, but one of the physicians, and then they would participate in those chart reviews with the physician that's doing them. That's what I'm looking for, and I'm, looking at the chart review. Are they looking at it? Are they making sure that all the elements that are required for the chart in there, and making determinations from that?
So is there a certain number of charts that need to be reviewed?
That is determined by the facility's policy.
Okay. Okay, let's see, I have some questions. I believe she said there was a link for a mock survey. Where did she say we could find that material?
That would be a link to the Office of Rural Health for the mock survey.
Oh, okay, yeah, I didn't know there was.
Yeah.
Let's see. Since I will be a first-time survey, okay, so this is the first time that she's been at the clinic and participated in the survey. Let's see, this has been very helpful. Oh, okay. I thought there was a question there. What are the requirements of the quality assurance program versus annual review?
Often the annual review is part of the quality assurance program. So as long as I see that the elements that are required are in there, then I'll take either one.
Okay. Okay, I am out of questions, and if there are no more questions from the participants, let me make sure.
Then I'll just add one last thing, is that the Office of Rural Health, if the clinics approach you, that you have a list of the tools that we use when we go into survey. So there are a couple of worksheets that I use when I survey, and one just goes through and is an explanation, things that I would look at. There's also a worksheet that has all the regulations and some guidelines for those, and Rhonda Ann has a copy of that. If you can get, and everything that we do is, I want it to be an open book. I don't ever want to go in and surprise anyone. So look at those regulations, request them from Rhonda Ann or the Office of Rural Health. Use those as guidelines. If you haven't had a survey before, you can just kind of go through and check off the list yourself, and they're really useful. And so anything that I can pass on to the Office of Rural Health to help the clinics, I will do it that way.
Which is awesome, and I always make sure I pass it on to the RHCs.
Yeah.
There is another question to clarify on the chart reviews. So Janice, my understanding is there's two type of chart reviews. There's the chart review that you discussed that's with a physician, not necessarily the medical director, as I understand it. So that's good to know. So it can be with any physician in the clinic. And that physician is reviewing the mid-level provider's charts. And that mid-level provider is also, they have communication, and the mid-level provider signs off on those charts as well. Is that correct?
Yes.
And that number of charts it's at the discretion of the clinic. And how I look at it is if the nurse practitioner or PA has experience, that MD may not need to review 10 charts a quarter. Maybe they only need to review 5. That would be up to your policy. And then if you have a practitioner that is inexperienced, that physician may need to review additional charts because that mid-level is a new provider. And that's how I look at it. Would you agree with that?
Yeah, often you'll see where they just, instead of doing a specific number, they do a percentage. So it might be 5% of the charts or 10% of the charts. And so, but I typically haven't seen policies where they differentiate between the level of experience of the mid-level practitioners.
Okay. So just to be clear, the chart review is performed by the physician with communication to the NP or the PA.
Yes.
Okay, so then go ahead, sorry.
Again, that NP or PA is part of that audit.
Okay. So then there's the chart review to make sure that the chart is complete. So that would be the patient's name and vitals and labs and a signature by the physician. And that doesn't necessarily need to be performed by the physician. That can be performed by the medical records person that's assigned to within the RHC rules and regs. In that clinic.
Maybe. Again, part of the program evaluation, again, I'm trying to do this off the top of my head. I don't have the rules and regulations in front of me. Part of the program evaluation is also, where the charts are reviewed. So that could be different criteria that they're using to review the charts and when the mid-level and the physician look at them. But that's up to the clinic as to what they're looking for. When I'm on site and going through the medical records, there are certain things I'm looking for. So the clinic will probably look at different things, from the practitioner's point of view that I necessarily wouldn't spend much time on. Okay, so my understanding is the physician's looking for quality of care in his review.
And on the medical records site, the chart review is for completion of the chart. And so the reason why I'm asking you this is because you don't want to waste, I look at it like this, you don't want to waste the provider's time if basically they're just looking through the chart. The medical records person is just reviewing the chart for completeness.
Right. And yeah, as long as you have someone reviewing it, is the chart authenticated? Do they have all the elements? Is the social data included there, the HMP, all those elements, are they filled out and according to their policies? Then, I'm okay with that.
Okay, that's awesome. Okay, well, Janice, thank you. It was so wonderful for you to take the time to.
Well, thank you all for participating. Sorry I wasn't able to participate by video. It just seems to be an ongoing thing every time I go to use that, but I'm glad we were able to make it work.
Thank you, Janice. This is Sarah. It looks like we had some technical difficulties at the end with Rondianne. So I want to thank all of the participants for joining in our first roundtable, and thanks to Janice again. And we look forward to seeing you or having you all join us on our next roundtable. Thank you so much. And this presentation is being recorded and will be available on our website, and Rondi Ann will send out that notification to everyone. Have a great day and a great weekend.
Thank you.